Dear viewers, this video is part 3 of the 3-part series on WBCs, Granulocytes, Functional Aspects in the Medicine for Anyone in the YouTube channel. Disorders of the mononuclear phagocyte system. Many disorders of neutrophils extend to mononuclear phagocytes. Monocytosis is associated with tuberculosis, brucellosis, subacute bacterial endocarditis, and malaria. Tuberculosis. This is a serious infectious bacterial disease that mainly affects the lungs, caused by Mycobacterium tuberculosis. The bacteria are spread when an infected person coughs or sneezes. Most patients infected with the bacteria don't have symptoms. When symptoms do occur, they usually include a cough, sometimes blood-tinged, weight loss, night sweats, and fever. Patients require a long course of treatment involving multiple antibiotics. Brucellosis. An infection spread from animals to people, mostly by unpasteurized dairy products. Brucellosis is a bacterial infection caused by Brucella species, which mainly infect cattle, swine, goats, sheep, and dogs. It affects thousands of people worldwide. Symptoms may include joint and muscle pain, fever, weight loss, and fatigue. Some people develop stomach pain and cough. Treatment includes antibiotics. Subacute bacterial endocarditis. Subacute bacterial endocarditis is a type of infective endocarditis. It's an infection that occurs when germs such as bacteria enter the bloodstream and attack the lining of the heart valves. This causes growths called vegetations on the heart valves. Dear listeners, by the way, this educational video is made possible by Prescribe-On, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribeon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Malaria. Malaria is a disease caused by a parasite known as Plasmodium, which is normally spread through infected mosquitoes. A mosquito takes a blood meal from an infected human, taking in plasmodia which are in the blood. The parasite is spread to humans through the bites of infected mosquitoes. People who have malaria usually feel very sick with a high fever and shaking chills. While the disease is uncommon in temperate climates, malaria is still common in tropical and subtropical countries. Monocytosis also occurs with malignancies, leukemias, granulomatous diseases such as sarcoidosis, regional enteritis, and some collagen vascular diseases. Note: sarcoidosis. It is a disease characterized by the growth of tiny collections of inflammatory cells known as granulomas in any part of the body, most commonly the lungs and lymph nodes. But it can also affect the eyes, skin, heart, and other organs. Regional enteritis. A condition in which the gastrointestinal tract is inflamed over a long period of time. Regional enteritis usually affects the small intestine and colon. Symptoms include fever, diarrhea, stomach cramps, vomiting, and weight loss. Regional enteritis increases the risk of colorectal cancer and small intestine cancer. Certain viral infections impair mononuclear phagocyte function. For example, influenza virus infection causes abnormal monocyte chemotaxis. Mononuclear phagocytes can be infected by human immunodeficiency virus (HIV). T lymphocytes induce phagocytosis and stimulates hydrogen peroxide production by mononuclear phagocytes and neutrophils. Autoinflammatory diseases are characterized by abnormal cytokine regulation, leading to excess inflammation in the absence of infection. These diseases can mimic infectious or immunodeficient syndromes. Monocytopenia. It occurs with acute infections, with stress, and after treatment with glucocorticoids. Drugs that suppress neutrophil production in the bone marrow can cause monocytopenia. Monocytopenia also occurs in aplastic anemia, hairy cell leukemia, acute myeloid leukemia, and as a direct result of myelotoxic drugs. Eosinophils. See the figure eosinophil shown already. Eosinophils and neutrophils share similar morphology, many lysosomal constituents, phagocytic capacity, and oxidative metabolism. Eosinophils express specific chemoattractant receptor and respond to a specific chemokine, eotaxin, but little is known about their required role. Eosinophils are much longer lived than neutrophils, and unlike neutrophils, tissue eosinophils can recirculate. During most infections, eosinophils appear unimportant. However, in invasive helminthic infections such as hookworm, strongyloidiasis, toxocariasis, trichinosis, filariasis, echinococcosis, and cysticercosis, the eosinophil plays a central role in host defense. Note: hookworm. These are intestinal blood-feeding parasitic roundworms that cause types of infection known as helminthiasis. Hookworm infection is found in many parts of the world and is common in areas with poor access to adequate water, sanitation, and hygiene. Strongyloidiasis is a disease caused by a nematode or a roundworm. Strongyloidiasis stercoralis causes the human disease. Toxocariasis is an infection transmitted from animals to humans, that is zoonosis, caused by the parasitic roundworms commonly found in the intestines of dogs called Toxocara canis and cats, Toxocara cati. Trichinosis, which is sometimes called trichinellosis, is a type of roundworm infection. These roundworm parasites, Trichinella, use humans to live and reproduce. Filariasis. Lymphatic filariasis, considered globally as a neglected tropical disease, NTD, is a parasitic disease caused by microscopic thread-like worms. The adult worms only live in the human lymph system. Echinococcosis is a parasitic disease that occurs in two main forms in humans: cystic echinococcosis, also known as hydatidosis, and alveolar echinococcosis, affecting liver, lungs, and brain, caused by the tapeworm Echinococcus granulosus and Echinococcus multilocularis, respectively. Cysticercosis is a parasitic tissue infection caused by larval cysts of the tapeworm Taenia solium. These larval cysts infect brain, muscle, or other tissue and are a major cause of adult onset seizures in most low-income countries. Eosinophils are associated with bronchial asthma, cutaneous allergic reactions, and other hypersensitivity states. The distinctive feature of the red staining eosinophil granule is its crystalline core, consisting of an arginine-rich protein, major basic protein, with histaminase activity, important in host defense against parasites. Eosinophil granules also contain a unique eosinophil peroxidase that catalyzes the oxidation of many substances by hydrogen peroxide and may facilitate killing of microorganisms. Eosinophil peroxidase, in the presence of hydrogen peroxide, initiates mast cell secretion and thereby promotes inflammation. Eosinophil-derived neurotoxin and eosinophil cationic protein are ribonucleases that can kill respiratory syncytial virus. Several factors enhance the eosinophil's function in host defense. T-cell derived factors enhance the ability of eosinophils to kill parasites. Mast cell derived eosinophil chemotactic factor of anaphylaxis, ECFA, increases the number of eosinophil complement receptors and enhances eosinophil killing of parasites. Eosinophil CSFs Example IL-5, produced by macrophages, increase eosinophil production in the bone marrow and activate eosinophils to kill parasites. Eosinophilia is the presence of more than 500 eosinophils per microliter of blood and is common in many settings besides parasite infection. Significant tissue eosinophilia can occur without an elevated blood count. A common cause of eosinophilia is allergic reaction to drugs, iodides, aspirin, sulfonamides, nitrofurantoin, penicillins, and cephalosporins. Allergies such as hay fever, asthma, eczema, serum sickness, allergic vasculitis, and pemphigus are associated with eosinophilia. Eosinophilia also occurs in collagen vascular diseases, example, rheumatoid arthritis, and malignancies, example, Hodgkin's disease, mycosis fungoides, chronic myeloid leukemia, and cancer of the lung, stomach, pancreas, ovary, or uterus. IL-5 is the dominant eosinophil growth factor. The most dramatic hypereosinophilic syndromes are Loeffler syndrome, tropical pulmonary eosinophilia, Loeffler's endocarditis, eosinophilic leukemia, and idiopathic hypereosinophilic syndrome with a count of 50 to 100,000 per microliter. Note, Loeffler syndrome. This disorder, namely Loeffler syndrome, manifests as eosinophil accumulation in the lung as a response to parasitic infection is an important concern in tropical medicine. This syndrome can be a response to several parasitic infestations. Ascariasis, that is roundworm, is a common etiology of this syndrome. Tropical pulmonary eosinophilia is a syndrome of wheezing, fever, and eosinophilia, seen predominantly in the Indian subcontinent and other tropical areas. Its etiologic link with Wuchereria bancrofti and Brugia malayi has been well established. These are all filarial worms. Loeffler's endocarditis is a rare restrictive cardiomyopathy caused by abnormal endomyocardial infiltration of eosinophils with subsequent tissue damage from degranulation, eventually leading to fibrosis. Although an uncommon entity, it is still a disease with significant morbidity and mortality. Eosinophilic leukemia. Chronic eosinophilic leukemia is a form of blood cell cancer characterized by an elevated number of cells called eosinophils in the blood. These cells help fight infections by certain parasites and are involved in the inflammation associated with allergic reactions. Idiopathic hypereosinophilic syndrome. Hypereosinophilic syndrome is a group of blood disorders that occur when you have high numbers of eosinophils. Over time, the excess eosinophils enter various tissues, eventually damaging the organs. IL-5 is the dominant eosinophil growth factor and can be specifically inhibited with the monoclonal antibody mepolizumab. Eosinopenia. It occurs with stress, such as acute bacterial infection and after treatment with glucocorticoids. Basophils and mast cells. Basophils are cells with similar kinetics and natural history of granulocytes that are produced and mature in bone marrow and circulate in the blood. In blood, basophils are round, whereas in tissues they can acquire various shapes. They retain certain features even after migrating into the tissues during inflammatory or immunologic processes. The basophils are generally round and have cytoplasmic granules and glycogen. They are found in many tissues throughout your body. The mast cell is very similar in both appearance and function to the basophil, another type of white blood cell. Although mast cells were once thought to be tissue-resident basophils, it has been shown that the two cells develop from different hematopoietic lineages and thus cannot be the same cells. The cytoplasm of the basophils generally stains pink. The nucleus is purplish or blue, and the cytoplasmic granules are dark blue to purple or even blackish. Basophils in peripheral blood or tissue range in size from 10 to 15 micrometer, whereas mast cells in tissue sites may appear irregular in shape and up to 20 micrometer long. Basophils have an abundance of condensed chromatin at the periphery of the nucleus, whereas mast cells have little condensed chromatin. In normal basophils, mitochondria and glycogen are more abundant than in mast cells. The most prominent cytoplasmic elements in both cell types are the membrane-bound, electron-dense granules. Basophils generally possess fewer granules than mast cells. Basophil functions. They are part of the immune system and play a role in its proper function. Preventing blood clotting. Basophils contain heparin. This is a naturally occurring blood thinning substance. Mediating allergic reactions. In allergic reactions, the immune system is exposed to an allergen. Basophils release histamine during allergic reactions. Basophils are also thought to play a role in causing the body to produce the antibody called immunoglobulin E, IgE. Basophilia. Increased numbers of basophils in blood. They protect from infections or respond to intruders like parasites, fungi, and cancer cells. Basophil blood levels are high in hypothyroidism, myeloproliferative disorders, and in autoimmune diseases. Dear viewers, this is the end of part 3 of the 3-part series on WBCs, granulocytes, functional aspects in the Medicine for Anyone in the YouTube channel. Thank you for watching the video.